Today our topic is cardiac arrest. This is a cessation of the normal circulation of the blood due to the failure of the heart to contract effectively. The medical personnel can refer to the unexpected cardiac arrest as a sudden cardiac arrest or ACA. Classification. They are classified based upon the ECG rhythm into shockable, non-shockable. In shockable, there will be the ventricular fibrillation and pulseless ventricular tachycardia. Non-shockable, there will be asystole and the pulseless electrical activity. Causes of the cardiac arrest. There will be two causes: cardiac, extracardiac, cardiac. In cardiac, there will be the primary lesion of the cardiac muscle leading to the progressive decline of the contractility, conductivity disorder and the mechanical factors. In case of the extracardiac, there will be the all cases accompanied with the hypoxia. Coronary heart disease. This is a major cause of the cardiac problem. There will be the approximately 60 to 70% of the SCD is relatable to the coronary heart disease. Among adults, ischemic heart disease is a predominant cause of arrest. Non-ischemic heart disease, the cardiomyopathy, cardiac rhythm disturbance, VTBF, asystole and PEA, the hypertensive heart disease and the congestive heart failure. In case of non-cardiac causes, SCD is unrelated to the heart problems. In 35% of the cases, there will be trauma, non-trauma relatable bleeding such as gastrointestinal bleeding, aortic rupture, intracranial hemorrhage, medication overdose, CA channel blockers and the digitalis beta blockers, drowning and the pulmonary embolism. In case of risk factors, sex, this is a major, it will be more greater in the men than women. The other factors like smoking, lack of physical exercise, obesity, diabetes and family history. HS and TS. This is the name for the mnemonic used to aid in the remembering the possible treatable or reversible causes of the cardiac arrest. In HS, there will be the hypovolemia, hypervolemia, hyperkalemia, hypokalemia, hypothermia, hypoglycemia, hyperglycemia, hypoxia and hydrogen ions. In case of TS, there will be the tablets or toxins, tachycardia, tamponade, tension, pneumothorax, thrombosis, thromboembolism and trauma. Signs and symptoms. The most reliable sign is the absence of pulse, unconsciousness, no breathing, no blood pressure, people speaking dilating within 50 to 45 seconds, seizures may or may not occur, death-like appearance, lips and nails burst from turn blue in color. Diagnosis. The cardiac arrest is synonymous with the clinical death. Lack of carotid pulse is the gold standard. For diagnosing the cardiac arrest is usually diagnosed clinically by the absence of pulse, but lack of pulse, particularly in the peripheral pulses, may be a result of other conditions, example shock, or simply an error on the part of the executor. In case of prevention, as the prime causes of the cardiac arrest being the ischemic heart disease, efforts to promote a healthy diet, exercise, smoking cessation. For people at risk of heart disease, the blood pressure control, cholesterol lowering will be occur. Management. Sudden cardiac arrest may be treated via the attempts of rescue. This is usually carried out based upon the basic life support, advanced cardiac life support, pediatric advanced life support, and the neonatal resuscitation program. Management. Cardiopulmonary resuscitation, defibrillation, medication, therapeutic hypothermia, extracorporeal membrane oxygenation services. Prognosis. Out of hospital cardiac arrest has a worse survival rate than in the hospital cardiac arrest. Although the mortality in the case of the ventricular fibrillation is high, rapid intervention with the defibrillation increases the survival rate. Survival rate following an arrest induced with the toxin are very much dependent on the identifying the toxin and administering the appropriate antidote. The overall survival following the cardiac arrest is 6.8%. Cardiopulmonary resuscitation CPR 16 of 73. Cardiac pulmonary resuscitation is an emergency procedure which is performed in an effort to manually preserve the intact brain function until the further measures are taken to restore the spontaneous blood circulation and breathing in the person in the cardiac arrest. To restore the partial flow of oxygenated blood to the brain and heart who are not breathing and do not have a pulse Objective: to delay the tissue death and to extend the brief window of the opportunity for the successful resection without the permanent brain damage. VF, VT, asystole and PA, drowning, stroke, foreign body airway obstruction, smoke inhalation, drug overdose, electrocoagulation, life-threatening injuries, suffocation, accident, coma and epiglottis. Pathophysiology: there will be the cardiac arrest, no blood flow and oxygenation, brain sustains the damage for 4 minutes, and after 7 minutes there will be the irreversible damage. After 2 hours the cells of the body die. In CPR, the blood is manually forced to circulate the brain and heart. The enough oxygen to the brain delay brain death. Allow the heart to remain responsive till the defibrillation. Methods: there will be the standard method, compression only in pregnancy and other. In standard method, the standard CPR includes both mouth-to-mouth resuscitation and chest compression. Compression only. This involves a chest compression without the artificial respiration. It is recommended as a method to choose for the untrained rescuer. In pregnancy, during the emergency, when a woman is lying on her back, the uterus may compress the inferior vena cava, and thus this decreases the venous return, so that the uterus may be pushed to the person left, and if this is not effective, either roll the person 30 degree or consider the emergency cesarean section. Other methods like internal cardiac massage. Steps in resuscitation: check for danger, check for response, check unseen for help, chest compression should be done, open the airway, check the breathing, and D stands for AED. Steps in CPR: recognition of the arrest, compression, managing the airway, rescue the breath. CAB should be done here: compression, airway and breathing. Recognition of the arrest: check for response, tap the victim on the shoulder and shout, "Are you alright?" No more than 10 seconds to check for the pulse. Adults, carotid artery; infants, brachial artery. Responsiveness is: tap the shoulder and shout, "Are you okay?" Do not move the victim until the CPR is given and qualified help arrives, unless the scene dictates otherwise. Threat of fire or explosion: victim must be on the hard surface. Place the victim level or head slightly lower than the body. Diagnosis of the cardiac arrest: blood pressure measurement, taking the pulse on the peripheral arteries, auscultation of the cardiac tones. Location of the carotid artery: maintain a head tilt with one hand over the forehead, locate the trachea using the fingers of the other hand. Slide these fingers into the groove between the trachea and muscles at the side of the neck, where you can palpate the carotid pulse. Palpate the artery for at least 5 seconds, not more than 10 seconds. Circulation: check the pulse. Check the pulse on the carotid artery using the fingers of the other hand. In infants, check in the brachial pulse. This is more easily located and palpated than the carotid pulse. Compression: push hard and fast, 100 per minute. Compression to relaxation rate, which is 50:50. To ensure the full chest recoil, minimal interpretation. Techniques: position yourself on the victim's side. Make sure the victim is lying on his back on a frame. The flat surface. If the victim is lying face down, carefully roll him into his back. Remove all the clothing covering the victim's chest. Put the heel of one hand on the corner center of the victim's beard, chest, between the nipples. Put the heel of your other hand on the top of the first hand. Straighten your arms and position your shoulders directly over your hands. Push hard and fast. At the end of each compression, make sure that you allow the chest to recoil completely. Deliver the compression at the smooth fashion at a rate of at least 100 compressions per minute. Circulation: restore the circulation. Start the external cardiac massage. Circulation, external cardiac massage. Effective chest compression. How CPR works? Effective CPR provides 1/4 to 1/3 of the normal blood flow. Rescue the breath contains 16% of oxygen in 21%. Two mechanisms explaining the restoration of a circulation by external cardiac massage: cardiac pump and thoracic pump. Cardiac pump during the cardiac massage. Rate pumping is assured by the compression of the heart between the sternum and spine. Between the compression, thoracic cage is expanding and heart is filled with blood. Thoracic pump at the cardiac massage. The blood circulation is restored due to the change in the intrathoracic pressure and the jugular and the subclavian vein wheels. During the chest compression, the blood is directed from the pulmonary circulation to the systemic circulation. Cardiac waves function as in the normal cardiac cycle. Airway management. Hit, tilt, chin, lift. Place one hand on the victim's forehead and push with your palm to tilt the head back. Place the finger of the other hand under the bony part of the lower jaw near the chin. Lift the jaw to bring the chin forward. Indication: cervical spine injury. Place the one hand on the each side of the victim's head, resting your elbow on the surface on which the victim is lying. Place your finger under the angle of the victim's lower jaw and lift with both hands, displacing the jaw forward. If the lips close, retract the lower lips with your thumb. Checking the vital signs. Airway. Open the airway. Head, tilt, chin, lift up. Ensure open the airway. Rescue the breath. Deliver each rescue breath over 1 second. Visible chest rise. Compression to ventilation ratio of 30 chest compression to 2 ventilation. In advanced airway, give one breath every 6 to 8 seconds without attempt to synchronize the breath between the compression. 8 to 10 breaths per minute. Types: mouth to mouth rescue breathing, mouth to barrier device breathing, mouth to nose and mouth through stoma ventilation, ventilation with bag and mask, ventilation with the supraglottic airway, ventilation with the advanced airway. Mouth to mouth rescue breathing. Hold the victim's airway open with the head, tilt, chin, lift up. Pinch the nose closed with your thumb and index finger, using the hand on the forehead. Take a regular breath, not deep. Seal your lips around the victim's mouth, creating an airtight seal. Give one breath over 1 second and watch for chest rise. If the chest doesn't rise, repeat the head, tilt, chin, lift. Give a second breath and watch the chest rise. Breathing. There will be the mouth to nose. Like when they can't open the mouth, can't make the good seal, severely injured mouth, and stomach distension, mouth to stomach tracheotomy. So mouth to barrier device breathing. Position yourself at the victim side. Place the mask on the victim's face, using the bridge of nose as a guide for correct position. Seal the mask against the face. Using the hand that is closer to the top of the victim head, place the index finger and thumb along the border of mask. Place the thumb of your other hand along the lower margin of the mask. Place the remaining finger closer to the victim neck along the bony margin of the jaw and lift the jaw. Deliver the air over 1 second to make the victim's chest rise. Mouth to mouth barrier devices, mask and shield. Airway, like nasal and oral, we can use all these instruments. Laryngeal mask airways, endotracheal tubes. Ventilation with mask. Bag we can use. Position yourself directly above the victim's head. Place the mask on the victim's face. Use the easy clamp technique to hold the mask in place. Perform the head tilt. Use the thumb and index finger of one hand to make a C, pressing the edges of the mask to the face. 3 fingers from E. Use the remaining fingers to lift the angles of the jaw. Squeeze the back to give the birth while watching for the chest ride. Infant CPR. Shout and gently tap the child on the shoulder. If there is no response, position the infant on his or her back. Begin the chest compression. 2 quick lung inflation. Infant CPR. If the baby is not breathing, give 2 small gentle breaths. Cover the baby's mouth and nose with your mouth. Each breath should be 1 second long. You should see the baby's chest rise with each breath. To rescue. One should kneel down the victim side and perform the CPR, while the other kneel at the opposite side near the victim head and deliver the artificial breath. Switch roles every 2 minutes. Stop the CPR when the person revives and starts breathing again on their own. Medical help such as ambulance, paramedics arrive to take over. The person performing the CPR is forced to stop from the physical exhaustion and the death of victim. CPR is continued for 30 minutes if the time to onset of the CPR is less than 6 minutes. Onset of a CPR greater than 6 minutes, CPR can be terminated after 15 minutes. Signs of the successful CPR: lung expansion, people will react to light and will appear normal. Normal heartbeat will return. A spontaneous gasp or breathing will occur. May move, legs, arms and color may improve. Predicting the neurological recovery, who do not awaken immediately after the CPR. Most important determination in the neurological recovery: coma greater than 24 hours, 10% of a chance of neurologic recovery. Greater than 72 hours, 5% chance of neurologic recovery. Greater than 2 weeks, no chance of full neurologic recovery. 72 hours point or GCS less than 5, little or no chance of neurological recovery. Adjunct devices, timing devices, those that assess the residue to achieve the correct technique, especially depth and the speed of compression, and those which take over the process completely. Why CPR may fail: delay in starting, improper procedure, that is example, forget to pinch the nose, no ACLS follow-up and delay in defibrillation. Only 15% who receive the CPR live to go home. Improper techniques, terminal disease or the unmanageable disease, massive heart attack. There will be complications in the CPR: locate blunt trauma, gastric inflation, bruising or fracture of the sternum or ribs. Compression at the Seifert process causes the laceration of the liver. Vomiting, aspiration, place the victim on the left side, wipe vomit from mouth with fingers wrapped in a cloth. Defusion and distribute the CPR. Stomach distension, air in the stomach creates the pressure against the lung. Prevention of the stomach distension: don't blow too hard, slow rescue breathing. Retilt the head to make sure the airway is open. Use mouth to nose method, require pressure. Thank you.